Hey everyone, welcome to my channel, Mental Health at Quick Synopsis. I'm your host, Chris, a psychiatric nurse practitioner, and today I'm breaking down fluoxetine, better known as the brand name Prozac. Whether you're starting it, thinking about it, or just curious, this is a quick synopsis guide to what it is, how it works, and what to expect. Fluoxetine is a SSRI, which is a selective serotonin reuptake inhibitor, commonly used to treat depression, anxiety, and OCD. It helps by increasing the amount of serotonin, a feel-good chemical in your brain. FDA indications, its use for a wide range of mental health conditions, most commonly depression and anxiety. Is also approved for OCD, panic disorder, bulimia nervosa, and premenstrual dysphoric disorder. Most people start at a low dose, usually 10 to 20 milligrams per day. Standard dose is 20 milligrams, and the dose can go up depending on how the patient responds. Maximum dose is 80 milligrams per day. Since it stays in your system long because of the long half-life, you only need to take it once a day, and morning is usually the best. It tends to be a little bit activating because of the norepinephrine and dopamine neurotransmitter, which causes increased energy in the morning. It takes at least 2 weeks to see some effects and at least 4 to 6 weeks to see the most therapeutic effect. Fluoxetine increases serotonin, a neurotransmitter that plays mostly in regulating our mood, digestion, sleep, and other bodily function. There is a small neurotransmitter of dopamine and norepinephrine as well. But fluoxetine works by blocking the reuptake of serotonin, making it more available in the synaptic cleft to be latched onto the postsynaptic receptors. It does take around 2 to 6 weeks for the effects to be beneficial, but most likely 4 to 6 weeks to be the most therapeutic. So patient is the key. Most side effects are mild and temporary. These side effects include nausea, headache, and sleep changes such as insomnia, if taken particularly in the afternoon. Other side effects include sexual dysfunction, restlessness, and anxiety. If they happen, please call your provider immediately. There's an FDA black box warning for the risk of increased suicidal thoughts for people 24 years and younger when taking Prozac. Thus, it's very important to monitor your mood and to notify your provider. Tapering and stopping. It's always best to collaborate with your provider about discontinuing or stopping any medication. The good news is that fluoxetine has a very long half-life, which means if you forget to take the dose or you taper off on your own, you're less likely to get those brain zaps or withdrawal. And I don't recommend tapering off on your own at all. Always collaborate with your provider. SNRIs like Eflexors or SSRIs like paroxetine and Paxils are difficult to be tapered off due to lots of withdrawal symptoms. So Prozac is typically used as a cross taper to help transition the patient off the Eflexor or Paxil. Special population. In pregnancy, fluoxetine is sometimes used if the benefit outweighs the risk. Fluoxetine is considered one of the most studied antidepressants in pregnancy and generally is safe. Fluoxetine does pass into the breast milk, but is generally considered compatible with breastfeeding, especially if it's the medication that works best for the mother. It's best to consult with your psychiatric provider and your OBGYN, as every treatment plan is different. In older adult population, we're careful about fall risk and drug interaction, and as for kids and teens, and it goes for all age group, we watch closely for any mood changes when starting fluoxetine due to the black box warning. Additional information regarding women's health and pregnancy, please check out womensmentalhealth.org. I will place the link in the description. A few clinical pearls I like to share is that fluoxetine has a very long half-life compared to all the other antidepressants, as it has the longest acting SSRI, and it may boost energy and helps with lack of motivation. Interestingly, of all the SSRIs, fluoxetine is most likely to cause rash. However, from my experience, I don't see that. Generally less favor in patients with bipolar disorder as well, as it can switch them to a manic episode due to fluoxetine's long half-life. Final thoughts. So fluoxetine isn't for everyone, but it does help a lot of people feel like themselves again. It's just one tool in the mental health toolkit. If you have any questions, talk to your provider and don't hesitate to advocate for your well-being. Thank you for watching. If you found this content helpful, hit a like, leave a comment, subscribe for more content. A quote of the day: take care of yourself, you deserve it. This is Chris, and you have a great day. Bye.